Hello everyone. It's so nice to see you and meet you. I'm so happy to have this opportunity to talk to you today. My name is Haneul Kim. Haneul means sky in English, so my friends call me Dr. Sky. I'm a rehabilitation physician and also director of International Clinic, Jaseng Hospital of Korean Medicine. I believe that similar to Korea, there is a higher demand and interest for treatment of spine and joint disorders in United States as well. So today I was talking about MSAT, the motion style acupuncture treatment and its application. But before we get into that, I want to briefly introduce our hospital first. Jaseng Hospital has 21 branches across Korea. Also, we have 5 branches in the United States, like San Jose, LA, Fullerton, Irvine, San Diego. So we are one of the largest Korean hospitals in South Korea, in Seoul. Jaseng has more than 400 medical staff with 1,450 inpatient beds. And we treat more than 1 million patients per year. And 80% of our patients suffer from spine and joint disorders, including herniated disc. We are certified by Ministry of Health and Welfare as Spine Specialist Korean Medicine Hospital, and we operate international clinic for foreign patients from different parts of the world. And we offer training program for doctors around the world wishing to observe clinical care and treatment method. Recently in Korea, the trend of integrative medicine incorporating the strengths of conventional medicine and Korean medicine is gaining more attention. Integrative Korean medicine is a combination of Western medical diagnosis and Korean medicine treatment. So when patients come to us for treatment, first we use Western medical diagnosis such as X-ray, MRI, CT, and blood tests, which tell us the root of cause of pain and diagnosis. So after that, based on this diagnosis, we perform the Korean medicine treatment such as herbal medicine, Chuna manual therapy, and acupuncture, MSAT, and pharmacopuncture. There are 4 major Jaseng treatments. First, MSAT, which reduces the inflammation in the tissues surrounding the spine and joint. The second, Chuna manual therapy, which restores balance and function by correcting misaligned structure. And herbal medicine and Shimbaro pharmacopuncture, which regenerate weakened muscles and bones. Among these treatments, today we will focus more on MSAT. What is MSAT? MSAT is a combination of acupuncture and motion. So unique characteristic of MSAT is that the patient doesn't lie still with acupuncture, but move at the same time to relax the stiffness muscles and ligament and boost the blood circulation of the surrounding tissues. MSAT stands for Motion Style Acupuncture Treatment. MSAT is being used increasingly often in South Korea. MSAT is especially effective for patients who suffer from low back pain with severe functional disability. Surgery can be effective where there is a clearly identified structural pathology, but due to its cost, the risk, surgery is often considered as a last option for back pain. While international clinical guidelines recommend traditional acupuncture treatment only for chronic low back pain, but MSAT also effective for acute low back pain. MSAT is similar to traditional acupuncture in the acupuncture needles are inserted into acupoints. However, MSAT is differ in that the patient moves passively or actively while acupuncture needles are inserted. MSAT has shown that the positive effect on immediate pain relief and the recovery of function state of acute low back pain patient. This is the case video. The patient who has a herniated disc and then who come in ambulance. So after MSAT treatment, he was able to walk afterward. So let's have a look together.
아이고 젊은 사람 왜 이렇게 디스크가 많이 심하게 터지고 그랬어요? 선생님 뭐 했어요?
보드 타다가
보드 타다가
부딪혀가지고
다리가 어느 쪽 다리가 아파요?
지금 양쪽 다.
양쪽 다? 일어서기도 어렵고
예.
똑바로 내리고 지금 올리기가 쉽 아파서 그렇죠? 숨 들어 마셨다가 내쉬고 이거? 오케이 숨도 못 쉴 정도로 아플 거예요 하나 둘셋 하나 둘셋 하나 둘셋 하나 둘셋 하나 둘셋넷 다섯 들어서 들어 트랙션해 트랙션 잘 뒤꿈치 대고 둘셋넷
다섯, 여섯, 일곱,
이래서 제로 빠져나가 팔 흔들어
셋, 넷, 다섯, 여섯,
빠져나가고 손 흔들고 팔 흔들어 거세 앞으로 쭉쭉 걷고 혼자 나가요 손 넣고 자, 자기 혼자서 걸어가 오케이 쭉쭉 걸어가 쭉쭉쭉쭉쭉 오케이 이렇게 움직여봐 이렇게 하나 둘셋넷 처음에 통증이 10이라는 게 지금 얼마 정도 돼?
지금 한 4 정도.
처음에 통증이 10이라면은 4? 많이 좋아졌지? 이제 웃어봐 너 이제
This is the process of MSAT. So first of all, two assistants provide support and traction on each side of the patient. And then a total of 5 acupuncture needles are inserted at neck and feet and elbows. And then assistant progressively lessen the level of support and traction as the patient regain walking ability. A total process takes about 15 to 20 minutes. So to prove the effect of MSAT, we conducted clinical research. The result was published in the Journal of Pain in 2013. Then entitled Effect of Motion Style Acupuncture Treatment with Acute Back Pain Patient with Severe Disability. This is a research design. So 58 patients with extreme acute low back pain was recruited and then randomly allocated into 2 groups, MSAT group and NSAID injection group, which means receive the diclofenac injection for their pain. And then pain and function were measured, and then the results were examined from as short as 30 minutes to 6 months after the treatment. This is the treatment result. So blue one is the MSAT group, and the red one is the injection group. So low back pain score and radicular pain score, also ODI score, they show the decreased significantly. So treatment effect of pain and function was superior for MSAT compared to the NSAID injections. Treatment effect for pain and function was superior for MSAT. So Pain decreased at 30 minutes after treatment. MSAT 46% and NSAT group is 8.7%. It means 5 times more greater than injection group. Also, this difference is maintained up to 6 months. Then these two graphs show that length of stay and rate of hospitalization were also lower for MSAT. The length of stay decreased to 5 days, and the rate of hospitalization was 27% lower. So it suggests that MSAT leads to the reduced treatment expenses, also socio-economic costs as well. The principles. The strong stimulation of distal acupuncture points in MSAT may enhance the effect of pain relief by triggering diffuse noxious inhibitory controls and increasing secretion of endorphins. If patients feel less pain and gain more mobility with encouragement and MSA treatment, the treatment could create a positive cycle leading to heightened therapeutic effects. MSAT can be used not only for the treating spine, but also shoulders, knees, wrist, and the chin and ankles as well. I'll show you a lot of different kinds of MSAT method. One is the Trapezius MSAT. This is also case video. It's a video treating neck pain patient after cervical surgery.
To begin the procedure, the patient is placed under general anesthesia. An incision is made in the left side of the neck at the level of nerve compression. In order to maintain good visualization of the surgical area, 2 small posts are screwed into the vertebral bodies, and a device is placed over these to help separate the 2 bones apart. This allows better access to the back part of the disc and spinal cord and nerve roots. Once the disc has been removed and the pressure taken off the nerves, demonstrated here is a peak spacer that is packed with allograft or cadaver bone. The distraction device is removed. The plate is placed into the wound and aligned over the vertebral bodies. Screws are placed through the plate and into the bone to secure the plate. The alignment is checked with X-ray imaging to ensure that the grafts are in proper position.
너무 아팠어요.
근데 그 수술 언제 했어요?
이제 8월 9일이면 3년 되거든요.
3년 전에 수술했는데 그동안 3년 동안 계속 이렇게 아픈 거예요? 여기다 이렇게 앞으로 해가지고 쇠를 뭐 3개를 박았어요? 묶었어요 여기다가 3개를?
예.
목뼈
3개를 묶어놨어요.
이거 아픈가?
네.
이것도 아파요?
네, 뒤로 하면 아파요.
뒤로 하면 아프고?
네.
이거 안 돼?
네.
이것도 아프고?
네.
네. 하나, 둘. 자, 고개를 이쪽으로 돌리세요. 더더더더더 동작침으로써 가동성을 늘려준다. 주죽 됐어요 이제. 주주죽, 주주죽, 6. 다 됐고요. 이제 다 풀었어요. 이쪽으로 돌리시고 이제 도리도리 빨리빨리 해봐. 이제 마음대로 편안하게. 셋, 넷. 고개를 이제 뒤로 제쳤다가 앞으로 숙였다가 뒤로 숙였다가 앞으로 숙였다가 힘 빼시고 이거 하고 이제 이거 돌아가죠? 아까 옆으로 했을 때 아팠는데 지금 이거 하고 이거 아파요 안 아파요?
괜찮아요.
예?
괜찮아요.
오케이?
네.
이제 마음대로 해도 괜찮아.
네.
알겠어요?
네.
이렇게 푸는 거야 이렇게.
This is the MST for neck pain patient. The aim of this treatment is to treat the pain from stiff neck and also restricted rotation and pain in these muscle areas. This MST consists of trigger point and tender point needling and gentle active movement of the head for recovery of normal function. So I will explain a little bit in detail. So step 1, divide the trapezius muscle into 3 parts, like 1, 2, 3, like this. Then step 2, normally we used the 4 centimeter length needles are used. So put the needles, the yellow one is the shoulder line, and then about 1 centimeter below in this line, we put the needles from back to front. And then about 3 and 4 centimeter depth. It's a common we use to place needles and 4 or 5 in here like this. So left side 4 and 5, right side 4 and 5 needles are inserted like this, 1, 2, 3, 4, 5. And then next step, we put another 2 needles in upper and middle trapezius in here. We called 견정, GB21 acupoints. We put 2 needles more in that. But there is a high possibility of pneumothorax. So to prevent pneumothorax, place the needles about 5 millimeters deep. So you have to be careful about this position. And then we need to operating the needles. The practitioner manually stimulate 견정 by rotating the needles while the patient rotate head from side to side. So when patient head turn to the left, we stimulate the right needles. So when patient turn head to the right side, rotate the needles on the left side, like this. And then there's also interesting part. The practitioner guide the patient to gradually increase the range of motion with encouragement such as more. So we gradually increase the motion, saying like more, you have to move more to the end. So like with this encouragement, help the patient become more invested and involved in their treatment and recovery. So this movement is repeated for 10 or 15 times like this. That's the trapezius MSAT. Okay, I'll show another MSAT. It's called shoulder joint MSAT. As you know, the trapezius muscle is one big muscle. So neck MSAT is simple movement, like a left, right, that's all. But as you know, the shoulder joint has a lot of muscles and ligaments, pectoralis muscles, deltoid muscles, teres minor, major. So it means the MSAT should move different directions, quite complicated. So I'll show you also this treatment as well. This case is adhesive capsulitis. During the lecture in Russian Medical University, there was a lady. She could not lift her arm completely, but after MSAT, she feel less pain and she could lift her arm freely. Okay, let's see this case first.
MST, 추나약물, 봉침 치료를 포함한 척추 및 관절 질환의 다양한 비술적 치료 방법을 소개하겠습니다. 혹시 이 중에서 아까 만약에 풀어주셔서 팔이 안 올라가시는 분들이라든지 쭈쭈쭈쭈쭈쭈쭈 No problem. Relax. 1, 2, 3, 4, 5, 1, 2, 3 쭉쭉쭉쭉쭉쭉쭉쭉쭉 오케이 굿 또 그만세
This is the shoulder joint MSAT. Maybe it can be a little bit complicated, but this treatment very useful for in the clinic for shoulder pains. So I'll explain step by step. Okay? Step 1. Have the patient's arm raised horizontally like this. And then between acromion and humerus, you found the acupoint 견우, the red spot in this picture. So put the needle in here, and then second needle is located 1 centimeter behind the 견우. Like in this picture, you will put the 2 needles like this. And then there are 2 types of movement are required. So first, the practitioner will move patient forearm first, up and down, like 10 times. And then practitioner will move upper arm, up and down, also 10 times. But it's very important, patient doesn't move at all, as all movement will be done by practitioner. The blue dotted lines show the original position of the patient's arm, and the red dotted line show the changed position to move. So blue is original, so forearm move to up and down, and then upper arm should move up and down. The 2 types of motion we have to move. That's the first part of the MSAT, and then we move the second part. And then take the needles, and then we put another 4 needles around the shoulder joint. Look at these pictures, so the front side, upper side, and back side. So the acupoints are called 견우, 견정, 중부, and 노수. Therefore, acupoints are used for treatment. And after that, the practitioner conducts a flexion and extension movement, and then gradually increase the range of motion by raising patient's arm like this and to the end. After that, the practitioner stands to the side of the patient at about 45 degrees, and then hold the patient's arm with both hands, and then rotate the patient's arm in a circling motions like this and like this. So we have to move quite a lot of direction to treat the shoulder joint, because the shoulder joint is a very complicated structure. Okay, this is the end of my presentation. So please try this technique if you have an acute muscle pain patient in your clinic. Thank you for your attention. Thank you.